Hi, everyone, and thanks for joining us on time. We are running a few minutes behind schedule and should be starting about 5 minutes late. Hi, Lacey. You look good. Thank you. Hi, Andrew. You look good. Hi, Dr. Kwanget. You also look good.
Thank you for the confidence boost, Julie.
That's what I'm here for.
Can you hear me okay too?
Yes, I can hear both of you loud and clear. And Dr. Shaw, I can see you now.
Great. Can you hear me okay?
Yes, mic check successful. Thank you.
Perfect.
We are just waiting for Michelle. All right, we're going to get started in 90 seconds. Good morning, everyone, and welcome to the Wednesday, January 19th COVID-19 media briefing. I'm Julie Grauert, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair Shah, Secretary of Health, Dr. Tao Kwanget, Chief Science Officer, Lacey Fehrenbach, Deputy Secretary for the COVID-19 response, Michelle Roberts, Acting Assistant Secretary, and Andrew M. Rose, COVID-19 Incident Commander. We are going to begin this morning with remarks from Dr. Shah. Go ahead.
Thank you, Julie, and I hope you can hear me okay.
Yes, we can hear and see you. Great.
Fantastic. Well, first of all, let me, as always, start by thanking our media partners for joining us yet again. We wanted to provide this update on the heels of our update a couple of weeks ago and really have an opportunity to remind everybody of all the different things that are happening, but also give updates on those various activities. There is a lot going on right now. But before I kick off to my formal remarks, I did want to recognize that tomorrow will mark the 2-year anniversary of the first case of COVID-19 that was identified in the state of Washington. And as you know, because Washington was the first state to identify a case, we were the first in the United States. That has started and has meant that at that point, not only did we identify the first case, but a lot of the nation was watching what this state was doing in response to COVID-19. And while many were still trying to get their plans in place, we as a state had no choice but to respond. And we have responded in kind over 2 years. But it has been a tough road for these last 2 years. And I know that we have reached some milestones that none of us wish we had reached. We have now identified 1 million cases of COVID-19 in the state of Washington. We sadly have had more than 10,000 people, Washingtonians, who have died from COVID-19 in our state alone. It has been a very difficult road for all of us. And I just could not say enough about all the people that have worked together to be able to respond to this pandemic for the last 2 years. I want to thank our public health partners, our tribal nations, everybody in communities across the state who have worked together to be able to respond to this pandemic. That also includes our healthcare system, our healthcare partners and workers who are going through a tremendously difficult time right now with this latest surge. We know that we are on our 6th wave of COVID-19. And again, this has been one of the most concerning waves because of the increases and levels of transmission that we're seeing across communities across Washington, but also because of the level of admissions that we are having in our hospital system, which is hospital systems, which are really making it difficult for everyone involved. So I wanted to start by saying thank you to all of our partners in both the public health and healthcare systems, as well as everyone in the private sector and all the other partners in education and the bus drivers, the ones who are making sure the ferries leave on time, all the different activities that have occurred across the state. But most importantly, I wanted to thank Washingtonians for everything they have done to continue to fight this pandemic. It has not been easy by any stretch of the imagination, but every time a Washingtonian gets a vaccine or puts their mask on or avoids a crowded situation or stays away from a certain setting because they're concerned about their health or someone else's health, they are working together to fight this pandemic. So I want to say thank you to you and thank you to all of our partners for working together. What we're going to be sharing today is a number of pieces of information. And as I just mentioned in my opening remarks, we have seen both high levels of transmission in our communities. We're also seeing increased hospitalizations as part of what's occurring in our system. There is some hopeful news, and Dr. Kwanget is going to be providing some of that hopeful news. So it's always good to have somebody who's going to be positive here. So thank you, Tao, for that. But at the same time, we also recognize that we still have several weeks of real challenges in our state when it comes to COVID-19 and fighting this pandemic. I also want to have additional hopeful news, which is around vaccines. And we have now crossed an incredibly important threshold related to boosters. We're now over 50% of our population that's eligible for vaccine boosters have received those boosters. And if we could show that graphic, and I'm going to kick it over to Michelle for just a moment here, very early. But Michelle, we have more than 2.2 million additional doses that have been given out across Washington. If we could show the next slide on the percentage.
The percentage slide, is down right now, so you can just
okay,
move on.
Got it. Thank you for that. We are just closing in on about 53% of the eligible population 12 and up have received additional doses of vaccine, booster doses of vaccine, and that just cannot say enough about that. So with that, Michelle, let me turn it to you if you wanted to just add any additional comments around vaccines and what we're seeing with our vaccine rates and numbers.
Thanks, Umair and Dr. Shah. Incredible work to see our vaccine numbers continue to increase. Everyone 12 and older is now recommended to get a booster dose of the mRNA vaccine. So Pfizer vaccine, if you're between 12 and 17 or 18 and older, either Pfizer or Moderna. And boosters are really the best weapon we have to fight the virus. We know COVID-19 vaccines prevent severe illness, hospitalizations, and death. We're learning a lot in real time about how these vaccines work, how long protection works, and how many doses we need for the best protection. And really, it's becoming more and more clear how important this booster dose is to continue to build our immunity and really continue to fight the emergence of Omicron and other variants, and keeping our health system whole. So the power of the vaccines to keep people from severe side effects from this disease is really important and helps us maintain our health system capacity, which we'll be talking about more in this briefing.
Thank you, Michelle. And again, just at 53% of our eligible population that has received additional or booster doses. And so cannot say enough about the tremendous work that's gone into that. And I want to really recognize the efforts on the ground to make this happen, especially Washingtonians. And I also wanted to really remind everybody from the governor's announcement over the last couple of weeks, as well as our ongoing DOH briefings, we've continued to provide support for our partners who are doing so many challenging things in our healthcare system and beyond. And so I did want to also talk about some progress that we have made on so many fronts. As you know, the governor announced a number of things related to masks and tests, and also a deployment of the National Guard, and also an additional vaccination site. So I wanted to give you a few updates on that. And I also have Andy Rose here. So Andy, I may kick it over to you for some of the additional specifics here. But as you know, the governor had announced that we were going to be making a host of masks that were going to be available to partners. And he had enumerated 10 million masks that were going to be available to community partners. And last week it was just shy of 2.5 million. I believe he said 2.4 million that had gone out the door. And so I'm glad to say that we are now at 5 million masks that have gone out. And Andy, if we could show, first of all, show the graphic if we could on masks. And Andy, if you could just talk about the different kinds of masks that have gone out from the state system here.
Yeah, thanks, Dr. Shaw. Yeah, great work by our team to really meet the demand to put these 5 million masks out to our local emergency management, local health jurisdiction, tribal partners, school districts, and others to be able to push these masks further forward into the communities where they're needed. So as of today, we've put 1.7 million N95s out through this program, over 1.5 million KN90 masks, and over 2 million surgical masks based on requests since the governor's order have gone out to be able to further continue to protect the public.
And I just want to remind everybody of the importance of, there's been some updates on CDC guidance for masks. And I think the clear message is that a cloth mask is better than no mask. And certainly if somebody does not have the ability to have a surgical mask or a higher level mask, you can also double up the cloth mask. You can add a surgical and a cloth together, or you can go to a higher grade mask. We obviously are recommending for certain settings, especially, that you absolutely go with a higher grade mask, especially in the healthcare system, for example. But we do want to recognize that there are things that people can do on an everyday basis to be able to protect themselves from a mask wearing standpoint. And I do want to also recognize that any mask is better than no mask. And I think the key message is, please make sure that you have a mask, you mask up, and you up your mask strategy as we continue to move forward. If we could then pivot to testing, as you know, the governor had announced that we had additional millions of tests that we were in the process of procuring. And I want to give so much credit to our Department of Health as well as our partners on the ground for the amazing work that occurred over the weekend, where over 1 million different kinds of tests were shipped over to schools and community partners this past weekend. So while it was a 3-day weekend for many of our team members, they were working around the clock over the weekend. And as you saw on social media, we were even getting those to schools, and you even have some images of those schools receiving those tests. So I really just want to thank our team for the incredible work that they did over this past weekend. And Lacey will give additional updates on this as well in her remarks. Moving to additional hospital surge, obviously we're working with Healthcare Authority and DSHS for a number of the different concerns from last week, including the capacity issues within the acute care system. We know our partners as well as our agency are meeting on a regular basis to discuss different steps that we may be able to take. And that includes this real concern around those who have completed their acute care in a hospital setting and are now ready to go either into a community setting or be able to go into a long-term care facility if it has space. And so we're working with DSHS and Healthcare Authority on this work. And I just want to thank our partners for that incredible amount of work that's happening behind the scenes. We also know that the governor announced the National Guard deployment. That coordination continues to happen. In fact, my understanding is with General Doherty that he has already deployed liaisons into the healthcare setting. And so that means that we are going to start to see those National Guard additional personnel that are now going to be coordinated to be in the 5 emergency departments and the 3 testing sites that the governor announced last week. The Everett vaccine site, the vaccination site, the medium throughput site that was to start this week did launch yesterday. And I just want to say thank you to our partners on the ground and everybody who's worked with us, because this, in addition to the site in Auburn, that, as you know, some of the team members were visited on Saturday. We now have a second site in the I-5 corridor north of the Seattle area in the Everett community. And so I just want to say thank you to our partners for getting this off the ground. It was not easy, but we certainly did that. So we have a number of updates from what occurred over the last week with the governor's announcement, but I do want to just thank everybody because we are making progress. But as you know, there is a lot more to be done, and we're continuing to work every single day on this. So with that, let me turn it back over to Julie so you can turn it over to our next speaker. But I just want to end by saying that there's so much that's happening. Just recognize that when we put information on social media or our website or during these briefings, we're doing our best to be able to provide updates to you because things are changing and evolving quite rapidly. Julie?
Thank you, Dr. Shaw. Let's go to Lacey now. Go ahead.
Good morning, everyone. Lacey Fehrenbach, Deputy Secretary, COVID-19 response. Several testing efforts underway, as you heard from Dr. Shaw, happening at the state and federal level. These efforts are about providing a public resource during a critical moment and making it easier for people to find tests. As we've noted before, home tests in particular are a key component of your medical kit at home and something we want you to have on hand before you need them. We also want to lift the burden off of our emergency departments right now so that critical care can go to people who really need it. Home tests, as a reminder, are a key tool in our public health toolbox to help us quickly know and conveniently know if we have COVID-19, and then swiftly take action to protect others if we learn that we have COVID. And that includes notifying people we might have exposed, either directly or through systems like OneNotify, which as of today has an estimated 3 million users across the state of Washington. The good news, as you heard from Dr. Shah, is there are more and more ways to get low cost or free home tests for COVID-19. This includes the federal website, covidtests.gov, where you can click and order through the US Postal Service up to 4 tests for your household free of charge. Those tests will usually ship to you in about 7 to 12 days. The federal government has also required insurers to cover the cost of at-home tests that insured individuals purchase. So specifically, insurance companies and health plans will be required to cover 8 free at-home tests per covered individual. So for a family like mine that has 4 people, that would be 32 tests per month. At the state level, we are launching a portal where people can also order a rapid at-home antigen test kit for their family. Within a few days, people across the state of Washington will be able to order these tests. Tests and shipping will be free of charge. We're going to provide 1 kit per household, and each kit will provide 4 to 5 tests. Once ordered, your kit will arrive within 1 to 2 weeks. In our first week, we're expecting to serve about 350,000 households across the state. And as a reminder, we have ordered more than 3.5 million tests for this program. However, those tests are coming into us over several weeks, and the portal is dependent on our supply. So while supply chains are improving, they are still strained, and when we are low or out of stock temporarily, you will not be able to order a test. So we ask for your patience, and we encourage you to check back if that happens. As more tests come in, we'll pick back up and take orders and get those tests out to Washingtonians across the state. For anyone with limited English or limited internet access, you'll be able to order your tests through the state's COVID hotline, which has language access resources. In the meantime, if you're looking for a test, you can purchase at-home tests at pharmacies and online retailers. And then a reminder that there are community-based test sites, pharmacies, clinics that offer both antigen and PCR tests. And the DOH website, doh.wa.gov/testing, is a great resource for finding access to those community-based test sites. Back to you, Julie.
Thank you for all that helpful information, Lacey. Now let's check in with Dr. Quanget. Go ahead.
Thank you, Julie. Good morning, everybody. As far as the epidemiology summary, cases in Washington continue to be high. And it's important to remember that the data we have is likely to be a substantial undercount, since many individuals who test positive at home are not reported and therefore don't get counted in our systems. However, there do seem to be some signs of a slowing of growth in cases in Western Washington. So there is some hope that we may be at or close to the peak in Western Washington. However, we are also seeing an acceleration in the growth of cases in some parts of Eastern Washington. So overall in our state, the situation will continue to be difficult over the coming weeks. Our genomic sequencing data shows that Omicron accounts for practically all of our new cases. Hospitalizations continue to be high. And as Dr. Shah mentioned, our hospitals and healthcare workers are still working under enormous strain. And even though the proportion of cases hospitalized has fallen dramatically with the Omicron variant, and could we show the next slide, please? So the 2 gray lines represent when different variants became dominant. So the middle gray line shows when the Delta variant became dominant in the summer, and the gray line on the right in December shows when the Omicron variant became dominant. And you can see that with the advent of the Omicron variant, the proportion of cases hospitalized has fallen dramatically. However, the unprecedented rise in Omicron cases that we have seen has resulted that even with this drop in the proportion of cases hospitalized, the absolute count in hospitalizations has been going up. And we have been seeing elevated hospitalization rates for all age groups compared to last fall, and they continue to be highest for the elderly as they have throughout the pandemic. Next slide, please. So as far as deaths, we're watching death trends very carefully. They had been on a steady decline over the last few months, but in recent weeks, there seems to be a little bit of a leveling off. We're not sure if this is a harbinger of perhaps a rise in deaths, which we sometimes see after a rise in cases and hospitalizations, or if this is just a temporary plateau. And so this is something we'll continue to watch carefully. So what these high case counts and hospitalization counts mean is that it's more important than ever for us to do all we can to support our healthcare workers. And so that means avoiding the emergency department unless it's an emergency. As Dr. Shaw mentioned, practice mask wearing and social distancing in public to reduce transmission. And most important, get vaccinated and boosted as soon as possible. We see that among Washingtonians, hospitalization rates are much higher than in unvaccinated populations than in vaccinated populations. And death rates are also much higher in those who are unvaccinated compared to those who are vaccinated. So get vaccinated and boosted as soon as possible, and make sure that your friends and loved ones are also vaccinated and boosted. And this is true for everyone, but especially those children and adults with chronic conditions who are at higher risk for severe disease. So thank you to those Washingtonians who have done their part in getting vaccinated and boosted, and a word of gratitude for our healthcare workers who are working under such stressful conditions to take care of people in our communities. Back to you, Julie.
Thank you, Dr. Quanget. Dr. Shaw, would you like to add anything before we go to reporter questions?
Sure. I just want to, again, a couple things to points to underscore. As Dr. Quanget said, that there are really important things that people can do, and we want to continue to empower people to be able to know what their risk is and also recognize that risk to others. And so that includes, obviously, first and foremost, is just being smart about the decisions that you're making on an everyday basis. And so we are recognizing that vaccines and boosters are a significant aspect of this. It is not the only way to protect yourself alone. They're necessary, but they're not sufficient. We do want to make sure people are doing the right thing by getting vaccinated. And I did want to bring up one additional statistic that Michelle had shared with us, that over the last week, more than 25,000 vaccinations have been administered on a daily basis. And of those, nearly 17,000 of those doses administered are additional or booster doses. And so that if you do your math, that's a 2-to-1 ratio of the boosters that we're having, but we're also still having people who are getting their primary vaccines. So if you have not had your primary vaccine yet and you have not initiated, we do want to encourage you to get your primary vaccine today. Or if you have received your 2 doses of mRNA vaccine or your 1 dose of J&J vaccine, and it's been a while, it's been a long while, more than 5 months on the mRNA or more than 2 months on the J&J, we want to encourage you to get your booster vaccine as well. And then in addition to that, obviously the messages around masking and social distancing and avoiding crowded, especially indoor settings, the importance of good ventilation, and even the importance of, we're going to have some clearing of weather over the next several days. When the rain goes away, we do want people to be outdoors if they can, and avoid those indoor settings as much as possible. And then finally, that last message that Dr. Quanget mentioned, which is really important for our healthcare system, just a reminder again that if you have no symptoms or mild symptoms, or you just want to figure out if things are okay, that is not the time to go to the emergency department. The emergency department should be left for somebody with a true emergency. And if you're not sure, please call ahead. Please make a call and figure out if what your symptoms are important enough to be going to an emergency department. Emergency departments right now in the healthcare setting are very stressed and they're very stretched. And I want to also say that last week, a couple of our staff members and I visited University of Washington, UW Harborview, as well as Kaiser Permanente's urgent care clinics. And I will tell you that there is tremendous amount of work that's happening on the ground. And I just want to recognize the absolute importance of people doing the right thing. We know that there are storms in front of us right now, and it feels the waters are choppy, but we also recognize that when we get past these difficult times, the waters will be calmer in the future and we'll have brighter days ahead. We just need people to continue to help each other and help themselves do the right thing. So with that, Julie, I'll turn it over to you and we can open it up for questions.
Great. Thank you, Dr. Shaw. We have 7 reporters in the queue, starting with Ariel from the Spokesman Review. Go ahead.
Thank you so much. I have 2 sort of separate questions this morning. First, I'm curious if people hospitalized with COVID during this surge are faring better or surviving more often than during the Delta wave. And then separately, what efforts are underway to address the low vaccination rate of 5 to 11-year-olds in the state? Thank you.
Thanks, Ariel. I'll take a crack at overall at that first one and then turn over to Dr. Kwan-Get, and then Michelle can add in on the 5 to 11-year-olds. We are seeing that the length of stay is shorter for those who are being hospitalized. Obviously, as Dr. Kwan-Get also showed that, there is a lot of proportionality improvement when it comes to those who are being diagnosed with Omicron with respect to how many of those are actually winding up in the healthcare setting. And certainly we're seeing less use of the intensive care unit, is particularly ventilators. But because we have so many people that are using and utilizing the healthcare system, unfortunately, it is still quite stressed, and you would be hard pressed to find hospitals that are not going to say that their intensive care units are not busy, full, or near full because of what's happening. We're also finding that about 80% of the people who are in the hospital setting with COVID-related diagnosis are unvaccinated. And I think that's a key message as well. So Dr. Kwan-Get, Tao, is there anything you wanted to add to that?
Yeah, I think all those points are so important. We are seeing an overall milder spectrum of disease. And so, as Dr. Shaw mentioned, shorter lengths of stay. We are hearing from our physicians, both in the outpatient setting and the inpatient setting, that the patients they're seeing today are not as ill on average as with prior variants. However, we still are seeing many patients in the hospital, many patients in the ICU, because we have seen such a rapid rise in cases. So even though it's true that the Omicron variant does cause a milder spectrum of disease, because we are seeing such a growth in cases, that's why we're seeing a continued rise in hospitalizations.
Yeah, and I can address the question about 5 to 11-year-old vaccination rate. So we do have about 30% of kids in that age group who've initiated. That actually is kind of on par with what we thought initially with some of the estimates of uptake that would happen with kind of the early adopters was about a third of parents. So we're kind of right about there. And you're absolutely right. There's a lot more work to do to help make sure people have the information and they need to make a decision to be vaccinated. So we know parents have questions about vaccines, and we're working to get accurate information out there through many different partners and many different channels, and really working to look at access really closely. It's behind the reason why we've done a lot of different mobile clinics we've done in different areas. It's why we've chosen the locations for the FEMA teams in Federal Way and Auburn. So in South King County, working really closely with Public Health Seattle King County, because they identified some access gaps there. So all of our mobile teams and the mass vac sites, including the one at the Everett Mall, serve children in addition to adult vaccination, and working with our pediatric care providers, so both family practices, pediatricians, others across the state, to understand what's going on in their clinics, how we can increase their capacity. And just like the rest of the healthcare system, primary care is really strained right now. They're doing a lot of testing. So all of our testing efforts are going to help to relieve some of the stress on primary care, in addition to working on kind of other strategies, helping with staff if they need additional staff to maybe monitor the waiting area or other things. So, and really talking with our primary care partners about what other resources they may need that's going to help them be able to continue to get more kids vaccinated. One of the most critical conversations is parents getting information and talking with their healthcare provider about why vaccination is a good choice for their child, the best choice to keep their kid protected. And how do we help ensure providers have a little bit of space and time to have those conversations? It's behind our Power of Providers initiative, about at every encounter, talking with families about COVID vaccine, the benefits, asking what questions they have. So there's a lot of efforts, and including a new campaign we've launched aimed at adolescent and youth vaccination. So I'll kick it to Dr. Quanget if he wants to add anything as a practicing pediatrician as well.
No, it's just that your primary care physician, whether it's a pediatrician or a family practice doc, they want what's best for your children's health and your family's health, and they'll tell you, to get vaccinated and boosted. But it is important that families feel really confident about the efficacy and safety of vaccines. I made sure that my daughter got vaccinated and boosted as soon as she was eligible. And if you ask anybody in healthcare or public health who has kids, they'll all tell you that they got their kids vaccinated and boosted as soon as they could. So, that's just a sign of how confident we are in the safety and effectiveness of vaccine.
Thank you. Our next question comes from Steve at Como. Go ahead.
Thank you much, Julie. I have two questions for you this morning. I think Lacey had mentioned that the web portal for at-home tests is going to be available in the coming days. Do we have an exact date for that? And what sort of interest do you expect, at least initially, and how's the state preparing for that? The other question I have is, how is the state deciding where its supplies of masks and at-home tests go? And I'm talking about the ones that have been distributed so far. Thanks.
Sure. So we're going within days, Steve. I would say watch this space closely over the weekend as we approach Friday and the weekend. We want to start this as soon as we possibly can. We also want it to be successful and a good customer experience for the people that use the site. And a really key portion of that is that we have tests to ship out to Washingtonians. So that is a pretty big driver in when we go live. The second part of your question, I believe, was how we're allocating out home tests and masks. So both of these are driven by local community requests that come in at the community level to either local emergency management or local public health. So it could be a community organization, a childcare, a church, it could be a healthcare system that makes an ask to their local emergency management or local public health, who then in turn makes the request to the state, and then the state distributes those out. We do have a direct pathway for schools because of a significant investment in school testing that Congress made through the CDC. So that there is a direct plug there to the at-home tests and other testing supplies that go to schools to help kids stay in school. But otherwise, the at-home tests for community-based organizations and the masks are going through that typical process that we use in any emergency or natural disaster. Andy, do you want to add anything to that?
Just one comment. I think for those that also have the ability to continue to access the commercial supply chain, please do so to support local business and the economy. Our state backstop is there to support in times of constraint and hardship in finding test kits and PPE, but we also want to be mindful of the, the outward economy and those that can and are able to do so. Please also stay in the commercial supply chain trying to purchase those yourselves as well.
Thank you. Our next question comes from Nicole from Cairo Radio. Go ahead.
Good morning. Do you have any idea of what percentage of the new cases, especially Omicron cases, are breakthrough? I think a lot of us who have had the vaccine and who have been boosted are really wondering how likely that we are to get Omicron if exposed. Additionally, it's near impossible right now to find a PCR test if you don't have symptoms, unless you want to go to the place in Bellevue that's charging $400 for a test. So what is your advice for people who need a PCR test for travel or possibly for work purposes? I'm hearing about people, for instance, who need to go to Canada for work and can't get across the border because they just can't find a place to get a PCR test.
Yeah, Nicole, I was so caught up with your second question, I actually failed to recall your first question. Could you repeat the first question? Apologies.
Sorry, I had a paragraph here in my Word document. The first question is just wondering if you have any stats on the percentage of new cases that are breakthrough, how likely that vaccinated and boosted people are to get Omicron if exposed.
Yeah, one of the, and I will turn this over to Dr. Quanguet for additional nuances, but one of the overall challenges that we have that we're trying to work through, as you saw with even the report that we released, I believe it was last week, on breakthroughs related to vaccines, one of the pieces that our team is now going back to look at is trying to get a delineation of when somebody has received that designation of fully vaccinated, and then they have the breakthrough. And let me break that down, Nicole, just a little bit more carefully. So if somebody received their, I'm just going to refer to the mRNA vaccine just to make it easier, got their mRNA vaccines, let's say 10 months ago, they did not get boosted. We have the Delta surge and now the Omicron surge. And now that individual who has not received the booster dose has a Omicron diagnosis or COVID-19 diagnosis, that would technically would fall into a breakthrough case because it is after the time frame where that person is considered fully vaccinated. We all know that we have been saying that you need to get boosted 5 months after the mRNA vaccine. And so now that individual has gone 5 additional months and has not gotten the booster, but is still in the designation of breakthroughs, they would be considered a breakthrough case, which is very different than someone who received their vaccine, finished their mRNA vaccine, let's say a month ago, or received a booster a month ago, and now they have a breakthrough case. So what, and this is not a scientific term, this is not even a term that is being used in the public health vernacular, I'm just using it. Those who are remotely vaccinated, those who have received their 2 doses, but it was a long time ago and did not get boosted, those are being considered in the same category as those who are recently boosted or recently vaccinated. And so what we're now doing as a team is to go back and tease that information out so we can get a better nuanced way of looking at does the breakthrough look at where we are with vaccines, does that change when it comes to more recent vaccination or recent boosters? So that's where we are as a team, and our team I've asked them to go back and look at this very carefully so we don't clump them all in one category of breakthroughs, but we really provide the full narrative and the nuanced picture of what's truly going on. So Dr. Quanguet, if you want to add details to that, I don't know if that made sense, even half the stuff I just said.
No, it makes complete sense. Yeah, we've known for a long time that Omicron does have the ability to evade prior immunity, whether that immunity is from prior infection or from previous vaccination. The mutations in the spike protein of the Omicron variant make it so that it's a little bit harder for the immune system to recognize that protein and mount a protective response against it. However, we still see that vaccination is still incredibly protective against hospitalization and death. So if your friend is telling you, hey, I got Omicron even though I'm vaccinated, since your friend's still alive, and if your friend does not wind up in the hospital, that vaccine did exactly what it's supposed to do. So vaccination, it's true, doesn't provide bulletproof protection against infection, but still very, very highly effective at preventing hospitalization and death. And so if you are vaccinated, the best way to prevent getting a breakthrough infection is to get boosted if you haven't already. So that's really the most important thing to keep in mind as far as breakthrough infections. If you're vaccinated, get boosted, and that's your best way to reduce your chance of a breakthrough infection. And even if you do get a breakthrough infection, despite your best efforts, you've still done a lot to make sure that you don't get severe illness that could wind you up in the hospital or worse.
Michelle was coming off mute. Sorry, Lacey, I don't know if she wanted to add anything on that last piece.
I was just going to add that there's a lot of disease circulating in our community right now, and we've got a new variant that's very contagious. And so I think we know there is people who work out of their home, they're essential workers, that's where their job is, or we need our kids are in school or childcare. And so there is exposure to disease. No vaccines prevent 100% of cases, including these vaccines. And like what Dr. Quanget was just saying, our immunity wanes over time, especially against reinfection, whether if you've had COVID or against infection if you've been vaccinated. The boosters help extend that protection, but it's not 100%. So we do expect some level of people to get disease. And the good piece is that, you are going to be, if you're vaccinated, very protected from severe outcomes of the disease, and hopefully not taking up resources in the healthcare system that are needed for people who may be at higher risk for severe outcomes.
Let me just be very blunt. If you are remotely vaccinated, if it has been well over 5 months since you've received your mRNA vaccine or 2 months over the J&J vaccine, you have not been boosted, or if you have not even started your current series, your primary vaccination series, you are a sitting duck. You are a sitting duck for this Omicron variant, and we need to get that message out. Get your vaccine and get boosted, because otherwise you're a sitting duck to this unprotected against this variant. And that is something we need to continue to get people to recognize. We've been saying this for weeks, we've been saying this for months, but unfortunately we still have far too many people who have not gotten boosted, and far too many people who are eligible, and far too many people who have not gotten their primary vaccine series. And that's unfortunate in our state. Lacey, I think you wanted to answer the second question.
Yes, I have. I'm going to answer Nicole's testing question, and I missed part of Steve's. So I'm going to come back and get the second part of Steve's question. So first, we do, as you've heard, have extremely high disease, and that is putting extraordinary strain on the testing system. There are a number of actions happening to increase access to PCR tests as well, and that includes the stand-up of some surge sites in partnership with the federal government. Those will be coming up within a few days here in Western Washington, in particular, Snohomish and King County. The second thing I want to emphasize is for people who have symptoms of COVID-19, if you have access to an at-home test and you test positive, consider yourself positive. You don't need to follow up and get a PCR test. Isolate at home. If you can manage your symptoms, do that. If you need to reach out to your primary care provider, do that. And of course, if you are severely ill, do absolutely seek medical care, but you don't need to go get a confirmatory PCR if you test positive on antigen. And that will, taking that step will help all of us unclog all of our resources. The second piece is for people who are traveling or they need testing for work. You really have to plan ahead and know what type of test you need, and look for services or test centers, including online swab and send services that meet the requirements of your destination or employer. Again, there are some of these in Washington State. There are also online services that you can do a swab at home and send it in, or do some destinations and some employers will just do an observed at-home test through like a telehealth visit. So plan ahead. And also a reminder, if you are testing for travel, you may have to cover the cost of your test. Insurers are not required to cover travel testing. Steve's question, I believe that I did not answer and will cover now, is what type of demand we're expecting to see on our public portal for at-home tests. We are expecting to see very high demand. And we know that there are going to be some bumps for people because the supply chain is still constrained. So I mentioned that we'll have we expect to have the ability to serve about 350,000 households. The first week, there are 2.9 million households in the state of Washington. So that means some of us are going to get that message that says we're out of tests when we go to order. And we really do encourage people to be patient and come back in a few days and see if there is more supply. It is our goal to serve the whole state of Washington, and we're not going to wait until we have 2.9 million test kits on hand, because that's going to take months, and we want to start getting test kits out now.
Lacey, I think we would be remiss if we did not mention the federal test site ordering site that also went live. I think it was yesterday or the day before yesterday. And so if we could, if our comms team can just provide that website URL, that would be great for our partners. If you could also make sure people are aware that, as the Biden administration has made clear, that they're making 500 million tests available to people across the country, one per household, one order per household. I believe it's 4 tests, if I remember correctly. So that would cover 125 million households across the country. So if we could just make sure before the end of this briefing, we have that information up. So that is another modality where people can also order tests. So I just want to make sure that that's also made available to our community members. Go ahead, Julie.
Our next question comes from Kate from the Yakima Herald Republic. Go ahead.
Hi, thank you. And thank you for sharing more information on the process for distributing supplies like masks and tests. I was hoping that you could give some more specifics on how many and where masks are being distributed in central and eastern Washington so far.
Yeah, I don't know if we have the specifics, Kate. We can get that to you after the briefing. I don't know if we have specifics on where everything has gone, but we have made it clear that we are distributing our supplies across the state of Washington, not just in one part of the state, but across the state of Washington, largely based on where people are asking and requesting. But certainly if we see an area where there may be more need, we can also make sure that we get supplies in that area as well. But we can get that for you, Kate.
Thank you.
Our next question comes from Cody from CREM. Go ahead.
Good morning. I kind of have a two-parter as well, but let's start off with the long one. Recently, we had a Meade school district that had to cancel their high school sports due to a lack of tests. Now, they told us that they had actually been waiting on a shipment of COVID tests since December 10th. They ran out of those tests last week, leading to the decision to cancel high school sports. They also told us they had offered to pick up tests themselves from Olympia, but were denied. And then they reached out to State Rep Jacqueline Maycomer, and she had offered to bring the tests over, but was also denied. Ultimately, they ended up meeting DOH employees in Moses Lake, where they acquired about 10,000 tests. So my question really is, why was there such a delay in getting the test, and why couldn't someone with the district or a state rep pick them up?
Yeah, let me, Lacey, if I could just make a quick comment and I'll turn it over to you. I think the first thing, Cody, that you brought up, I think is really important, is that we have been working with our schools to remind them that the most critical aspect of where testing should be employed is really to make sure that kids are remaining in the classroom. and they're getting the education. And we absolutely recognize the extracurricular activities and sports. I played myself, so I recognize how important it is. But I do want to make sure that we're emphasizing our focus really is to make sure that schools have the supplies for being able to keep kids in school for educational purposes. That said, there have been some logistical challenges, especially around the holidays and weather, that also played into some things. But Lacey, I'll turn it to you or Andy if you want to add some additional details.
Yes, so thanks for the question. We are aware of those requests from Meade School District. I want to emphasize that, we are trying to get all schools the supplies they need to test their students and staff. And as Dr. Shaw mentioned, the priority and the funding that we receive to support our school testing program is specifically to help students remain safer in classrooms. And we have to distribute across the whole state. So there have been supply chain issues. I think we have been transparent about those challenges, and they, of course, became extremely exacerbated by the level of soaring disease we saw in December and January with Omicron, which increases demand for testing everywhere, including in schools. Schools are testing students and staff that have symptoms. They could also be doing repeat testing of staff, and many of them do repeat testing of their athletes. So there were a number of delays, but I am happy to share that after snowstorms and floods that delayed shipments coming in and our ability to move things out, we had an extraordinary team come together, and it involved volunteers from other agencies. It involved support from Costco and Amazon, and it involved some of our own staff driving over the weekend to get more than 600,000 tests out to schools, including the Meade School District. We have also taken a number of actions to hopefully increase our own capacity as we navigate through the Omicron wave, where schools are using supplies at rates they never have. And just a data point around this, in August, ahead of the school year, we sent out about 400,000 tests for the month. And right now we estimate that schools statewide need about 500,000 tests a week. So it is a huge increase in demand that we are seeing. But we have upgraded our shipping status where we're using commercial shippers. We have added our own trucks and drivers to the mix, including with support from other agencies in state government. We have added staff to our warehouse, and we do limited will call pickup. But I really want to emphasize that this is limited because we want to make sure that we have the tests that school needs. We don't just want people showing up at our warehouse. It's not really set up as a typical place or point of dispensing. Our goal is really, for the most part, to use our own shipping process to get those tests out to schools.
Thank you. Our next question comes from Spencer from CNBC. Go ahead.
Hi, good morning. You mentioned at the top that we are approaching the date of the first confirmed coronavirus case in the US, which was found in Washington State. I'm just wondering if you could help us take a look back over the past 2 years. How has the epidemiology of the pandemic changed over that time? How has the virus changed? And what can we do to anticipate future variants so we don't have these dramatic spikes of infection every few months?
Spencer, thank you for taking us back over this historical journey. The 2 years, and in full disclosure, I was not here during that early part of 2020 when the frenzy of activity happened. As you know, I became the Secretary of Health in December of 2020, and so I was watching it on the front lines in Texas and responding, but also recognizing what our partners in the state of Washington were going through. In fact, had made contact with many folks both at the state and local level as they were going through some of these really challenging times. I think what we've learned and what we've seen is that this is a relentless pandemic, and it comes in waves, and very similar to what we saw back in 1918, the waves are important to see them as phases that are mini phases of a larger pandemic response. And so initially it was the frenzy of activity to understand the virus, understand the protections against the virus, and all the different tools that were necessary to characterize who was sick and who was infected, and how to go about getting the protections and the right messages to those individuals. Then it became a significant issue around supply chain, which, as Lacey just demonstrated, remains even 2 years later a significant issue in our nation, which is supply chain challenges that at that time included masks and obviously testing supplies and all sorts of reagents and everything else that was in the mix. We then shifted to messaging and policies that were very much really challenging for all of us. That meant lockdowns and closures and real aspects of what we call interventions or non-pharmaceutical interventions that were very much about keeping people protected. And so there were a lot of stay-home orders that were in the mix. And all we had at that time were those policies plus masks, plus social distancing, plus hand hygiene, and that was it. And then lo and behold, December of 2020, we had the promise of vaccines. And, you know, we have to give an incredible amount of credit to the Operation Warp Speed and the ability to develop vaccines. And December of 2020, when I don't think many around thought it was possible, all of a sudden we saw vaccines arrive in the state of Washington. But then there was an additional frenzy of activity, which was well planned because our state spent months and months prior to this planning prioritization and how we were going to get vaccines out, but the supplies were very limited. And so the initial was the prioritization of who was most at risk and who should get vaccines. That started from December and January of December 2020 into January of 21. And we continued to move forward. And we saw light at the end of the tunnel because of so many Washingtonians that have been vaccinated. And somewhere in the summer, the roadmap to recovery meant that we were now seeing our state reopened, and there was a celebration and commemoration of that reopening, but there was also a smaller headline, which was the pandemic is not over. I think a lot of folks glossed over the second part of that headline, which was this pandemic is not over. And we started to see weeks later the Delta surge, and then the Delta surge meant that that point was one of our most difficult surges that we had. But then you turned around and now you have the Omicron surge that started in late November, early December. So this has been multiple phases and multiple pandemics, mini pandemics in the midst of a large pandemic. And throughout that, we've had to employ tools and policies and make sure we have supplies and make sure we have the messages so that our community members and our partners on the ground know that this pandemic has evolved, the virus has evolved, and our response to it must continue to evolve. We're always trying to stay one step ahead of it, but as you know, that has been challenging when you have new variants and you have real new mutations to a virus. That means that largely some of those very tools that you're using have to be rethought of in how they're effective now as you move forward. We have the promise of antivirals, we have the promise of monoclonal antibodies, we have the promise of making sure people are empowered with messages. We know that we're going to be living with COVID for a long time coming, but at the same time, we also recognize that we still have some very specific tools around vaccines, boosters, masks, and hygiene, and making sure that we know the kinds of things that we need to do to empower ourselves to be safe and protected. And that's where we are today. So I Spencer, want to just thank you for that question, because it does remind all of us of the journey that we've been on. It has not been an easy journey. I'm very proud of the state of Washington, all Washingtonians who have come together to be able to respond to this pandemic, but we are far from over. And so we continue to see light at the end of the tunnel. That tunnel just continues to be at times dark, and then it gets lighter, and then it gets dark, and it gets lighter. But we do know at some point that tunnel will end. So with that, unless Tao or Lacey, Michelle, Andy, anything you want to add? I know we have 2 more reporters in the queue. We will go a few minutes longer to make sure we get everybody, but any additional comments from the 4 of you?
I could just say something briefly about sort of what lies ahead possibly. I mean, our hope is that the immunity of our population that's been achieved through vaccination, and that the immunity of our population that has occurred from infection, from past variants as well as Omicron variants, that this population level immunity will help see the end to the pandemic. But there's so much that's unknown. It is quite possible that a new variant could arise that is able to evade our immunity from vaccination, or immunity from past infection from Omicron and other variants. And so that's the real unknown. But I think what we can do to try to decrease the chance that will happen is get as many people vaccinated, not only in the US, but throughout the world, vaccinated as soon as we can, because the larger the population of people who are infected, the more chances the virus has to mutate. And the greater opportunities to mutate, the greater the chance that a mutation will arise that can evade our immunity from vaccination or infection. So I think there is hope for the future. There is a large unknown, but some things are within our control. And I think one of the most important things is getting as much of the population, both in our state, our nation, and in the world, is vaccinated as soon as possible.
Just a few quick thoughts about this. I really appreciate the question. First of all, I think the first thing I want to emphasize, and Dr. Shah and Dr. Quanget have spoke very eloquently to this, is to follow the science, and part of that means learning as you go. And I know it's been really hard for people to hear changing messages, but that is how science works. And I think the second piece, and Dr. Quanget spoke to this, is be humble. We are going to still learn lessons and learn more and have changes and setbacks as we continue forward, navigating through this and recovering from the pandemic. But we are on a path to recovery. And I think the last, really big lesson for me that we've learned as a society is we are all connected, and our individual actions, all at every choice we make together, impacts us as a family, as a city, as a state, as a nation, as a world. And it comes back to affect us on the individual level. So whether that's from the early days of staying home and wearing masks to the tools we have now, like getting vaccinated, getting tested at home, using Law Notify, every choice we make adds together to keep us safer and our community safer.
Thank you, Lacey. This next question comes from Paige at KUOW, and I will be asking on her behalf. Can you give a more detailed forecast for what you anticipate will happen with the curve of cases? Dr. Shah mentioned Western Washington cases may be dropping, but not Eastern Washington yet. Should people buckle down more socially for the next few weeks?
Yeah, actually, I believe that may have been Dr. Quanget that had mentioned the Western and Eastern, but I think the point that we are mentioning is really important, that not surprisingly, we were seeing Omicron take hold in Western Washington. That oftentimes happens with infectious diseases, including variants where you have more metropolitan areas where you start to see the increases. and then it starts to spread to other parts of the state because we're interconnected. And that's exactly what's happening, is that we're seeing increases in cases and hospitalizations in Western Washington. Eastern Washington initially was relatively less so, but that is now starting to change. And so as Western Washington may begin to, at some point soon, hopefully, fingers crossed, level off, and we start to see declines, that you still have the Eastern Washington or other parts of Washington start to see those increases and not level off or decline for some period of time. So our forecast remains that the next several weeks are going to be very difficult. And that means through not just the end of January, but probably through a good portion of February, we're going to have some challenging times. And I also want to remind everybody that it's like a rubber band, that when you stretch a rubber band, that rubber band can eventually break. There is a constant tension that a rubber band takes, but even a constant tension eventually can break that rubber band. And what we need to do is to really reduce that tension. And that means that there are certain things. And the second part of your question is, should people buckle down more socially for the next few weeks? I think people should be thinking that. We've got a lot of things coming up. Obviously, we've got sports and Super Bowl and things of that nature. We've got Valentine's Day coming out. We got, people who want to go out and do things as the weather is better. And we want people to be doing those activities, but empowering themselves with how do they protect themselves and are safe in the process. And so we're not at a place right now where we're, as Spencer asked the question about where we were previously from the policy standpoint, we're doing everything we can so people can go on with their lives, but just do so safely. And so I think that's really our clear message. The other piece of this is that, of course, what's happening in the hospital system will take time to also manage and clear. So when you hospitalize someone, that some proportion of those people will have a complication, will go into an ICU, or may have a longer length of stay. That means that system starts to surge and stretch, and it just becomes harder and harder to be able to see that system improve until you give it enough time and you start to decrease the number of people that are coming into the system and or increase the number of people that are able to exit that system. So a lot that's ahead here. And Tal, I don't know if you wanted to add anything to that, from a crystal ball standpoint. I know none of us have it, but if there's anything else you want to add.
Yeah, thanks, Dr. Shaw. Yeah, we have been watching what's happening in other parts of the country and other parts of the world very closely. In South Africa, we saw a very rapid rise and are seeing a fairly rapid decline. And so that's certainly what we hope for. However, in other countries in Europe, we've seen a rapid rise and a slower decline. And it's thought that the slower decline might be a sum of many different communities within a country having rapid climbs and descents, and the net effect showing for a country a slower decline. On the East Coast, we're seeing that some states seem to be past a peak or on a decline. So we don't have a forecast or a prediction or crystal ball. But I think it just comes down to doing what we can to reduce transmission. And so that means, getting vaccinated and boosted, as we said. And while I don't think we need to be hermits, I think it is important to socially distance, especially when we're indoors, wear a high quality mask, especially when we're indoors. And then if you have symptoms, assume that you're infected and stay home, stay away from other people until either you finish your isolation or get tested and find that you're not infected after all. So it's the summation of all these things that we do individually that's going to help us as a community affect the curve in the coming weeks.
And our final question comes from Esther at KXLY. You just touched on Eastern Washington and Western Washington, but she followed up by saying, can you break down the issues we're seeing in Eastern Washington that have you more concerned in comparison to Western Washington?
Yeah, I think the only other thing that I would just remind everybody is that those protective measures that we have in place across the state of Washington, and it's not an east-west issue, it's just everywhere. It can be in the middle of a highly vaccinated community. You have pockets where you still don't have people who are vaccinated. In a community that has, by and large, higher mask wearing usage, and you may go to a neighborhood and people in that neighborhood say, I'm not going to wear a mask. I think what we may be seeing in certain parts of our state is those protective measures that we have seen in other parts of the state, higher vaccination rates, higher mask usage, making sure those, especially in the public forum settings, that, the activities that are occurring without as many protections. We really are just seeing those in other parts of the state more so than in places where you have more protective measures that are being followed. And so again, let me wrap by saying thank you to everybody. We're at the 2-year mark of this virus in our state. And we are now in the midst of Omicron's surge, which has really impacted our communities, but also impacted our healthcare system. We ask for people to empower themselves with good information and follow good guidance to be able to protect themselves and those around them. Please get vaccinated. Please get boosted. Please do everything you can to use those common sense and science-based approaches to protect yourselves, your loved ones, and those around you. And ultimately, we will have several weeks more of very difficult times, but we do know that there is going to be sun on the other side of this, as there always is through these waves. And so really hope that all of you will continue to work with us, and we're going to be doing everything we can to continue to update you as we move alongside with you. So with that, I just want to thank all of our media partners, and I want to thank my colleagues at DOH, who, as always, do a fantastic job of answering questions and providing all the details that I don't have. And I really appreciate that from Tao and Lacey and Michelle and Andy. And with that, Julie, I also want to turn it over to you to close, but I also want to recognize that this may be the last briefing that you will be having with Department of Health. And I want to wish you all the best in the future. You've done a fantastic job, as all of our comms people do. In particular, you have a very positive, smiling presence. And we just want to thank you for your incredible efforts. And we wish you all the best. And thank you again for leading us through these challenging, at times, media briefings throughout the last several months.
Oh, well, thank you very much. It has been an honor and a pleasure. I appreciate it. I'm a little embarrassed now, but that concludes today's media availability. Thank you so much to everyone who attended. Our next one is scheduled for February 2nd, and the one and only Corey Portner will be at the helm. Have a great day.